Remifentanil is a potent opioid analgesic used in anesthesia and pain management. Here are some key points about its pharmacology. 1. Chemical structure. Remifentanil belongs to the class of opioids and is a synthetic opioid receptor agonist. 2. Rapid onset and offset. One of its unique features is its ultra-short duration of action due to rapid metabolism by esterases in the blood and tissues. This rapid metabolism results in a quick onset and offset of its effects. 3. Mechanism of action. Remifentanil primarily acts on the opioid receptors in the central nervous system. Activation of these receptors leads to analgesia, sedation, and respiratory depression. 4. Clinical uses. It is commonly used during surgery and other medical procedures to provide pain relief and sedation. Its rapid onset and short duration of action make it ideal for procedures of varying lengths. 5. Dosage. The dosage of remifentanil is carefully titrated based on the patient's age, weight, and the nature of the procedure. Because of its short duration of action, it can be administered as a continuous infusion. 6. Metabolism and elimination. Remifentanil is rapidly metabolized in the blood and tissues, primarily by esterases. This rapid metabolism results in a context-sensitive half-life, which means that the duration of its effects is not significantly influenced by the duration of infusion. Remifentanil is a potent opioid analgesic used in anesthesia and pain management. While it is highly effective for pain relief, it can also produce various side effects. The most common side effects associated with remifentanil use include 1. Respiratory depression. This is one of the most significant concerns with opioid medications like remifentanil. It can lead to slow or shallow breathing, potentially resulting in hypoxia and insufficient oxygen in the blood. 2. Sedation. Remifentanil can cause sedation or drowsiness, which is often desirable during surgery or medical procedures. However, excessive sedation can lead to prolonged recovery times or delayed awakening after the procedure. 3. Nausea and vomiting. Some patients may experience nausea and vomiting as side effects of remifentanil. These side effects can typically be managed with anti-nausea medications. 4. Hypotension, low blood pressure. Remifentanil can cause a drop in blood pressure. Healthcare providers may need to intervene with medications or adjust the infusion rate to maintain blood pressure within a safe range. 5. Bradycardia, slow heart rate. A decrease in heart rate may occur with remifentanil use, and healthcare providers may need to address this with medications or other interventions. 6. Rigidity. In some cases, muscle rigidity, particularly of the chest wall muscles, may occur with high doses of remifentanil. 7. Itching and skin reactions. Itching, often referred to as pruritus, can occur as a side effect of opioids like remifentanil. Skin reactions, such as rash or redness, may also occur in some individuals. 8. Constipation. Opioids like remifentanil can slow down the digestive system, leading to constipation. This is more of a concern with long-term opioid use but can still occur during short-term use. 9. Postoperative shivering. Some patients may experience shivering after surgery as a side effect of remifentanil. This can be managed with warming blankets or other measures. Remifentanil, as an opioid medication, can interact with other drugs, potentially leading to additive effects, side effects, or drug interactions. Here are some of the most common drug interactions to be aware of. 1. Other opioids. Concurrent use of other opioids, e.g., morphine, fentanyl, oxycodone can result in additive effects, increasing the risk of respiratory depression and sedation. This should be carefully monitored by healthcare professionals. 2. Sedative medications. Combining remifentanil with other sedative medications, e.g., benzodiazepines, barbiturates can lead to increased sedation and respiratory depression. This combination should be used cautiously and monitored closely. 3. Anesthetic agents. When used in the context of anesthesia, Remifentanil may be administered alongside other anesthetic agents, e.g., propofol. Isoflurane. The combination should be carefully managed to maintain appropriate anesthesia and prevent excessive sedation. For monoamine oxidase inhibitors, MAO is a class of antidepressants. Combining them with opioids like remifentanil can result in increased opioid effects and the risk of serotonin syndrome, a potentially life-threatening condition. 5. Muscle relaxants. The use of muscle relaxants alongside remifentanil may increase the risk of muscle rigidity. 6. Certain antibiotics. Some antibiotics, e.g., linezolid, can interact with opioids and increase the risk of serotonin syndrome or other adverse effects. 7. CYP3A4 inhibitors and inducers. Remifentanil is primarily metabolized by the enzyme CYP3A4. Drugs that inhibit or induce this enzyme can affect the metabolism and clearance of remifentanil. Common CYP3A4 inhibitors, e.g., ketoconazole, clarithromycin, may increase remifentanil levels, while inducers, e.g., rifampin, may decrease its effectiveness. 8. Antiretroviral medications. Some antiretroviral drugs used to treat HIV can interact with opioids, potentially leading to increased or decreased opioid effects.